Welcome back to The Explainer. Today, we're diving straight into the dense neuroanatomy of the human neck. We're going to isolate, define, and map out a highly tested, absolutely vital structure. Yep, we are talking about the Ansa Cervicalis. Let's get right into it.
To make sure our map is incredibly precise, we're pulling our diagrams and definitions straight from the gold standard Vishram Singh's textbook of anatomy. Grounding our explainer in this specific text means the pathways we trace today are exactly what you need for that high-level clinical understanding. No guesswork here.
Okay, here's our quick roadmap. We'll start with the neck's anatomical neighborhood, meet the Ansa cervicalis itself, break down its roots, see exactly how it wires up the strap muscles, and then wrap up with the infamous thyrohyoid exception.
Starting with part 1, the neck's anatomical neighborhood.
So before we can really understand the Ansa cervicalis, we gotta drop a pin on our map. Imagine zooming right into the anterior triangle of the neck, specifically into the carotid triangle. Here, you'll find the carotid sheath. You can think of this sheath as a tightly packed, vital fascial highway. Inside, you've got the internal jugular vein, the internal and common carotid arteries, and the vagus nerve tucked safely right between the vein and artery on a deeper plane. But look at that last bullet point. Right there, embedded in the anterior wall of this sheath, is our target. It's not just floating around in space, it's architecturally fused to the front of this fascial boundary.
Which brings us to part 2, meet the Ansa cervicalis.
Now that we found its exact address, or that anterior wall, what exactly is the Ansa cervicalis? Well, historically it was known as the Ansa hypoglossi, and it's essentially a U-shaped nerve loop. I mean, it literally looks like a suspended loop of wires sitting right there in the carotid triangle. The shape is the whole giveaway here, because Ansa actually translates to loop or handle in Latin.
Moving to part 3, breaking down the roots.
So, a loop needs two sides to come together, right? Zooming in, we can see this U shape is built from two distinct halves, or roots. First up is the superior root, also called the Descendens hypoglossi. This one carries fibers from the C1 spinal nerve. Visually, just picture this root dropping straight down, physically passing right over the internal and common carotid arteries. Then, on the other side of the loop, we have the inferior root, or Descendens cervicalis. This one carries fibers from C2 and C3. But instead of descending over the arteries, this root takes a totally different path and winds around the internal jugular vein. So remember, superior is C1 over the arteries, and inferior is C2 and C3 around the vein.
Let's trace this pathway down and see how it all connects. We start up top, where the roots originate from the ventral rami of C1, C2, and C3. As we move to step 2, the superior root descends over the carotids. Step 3, the inferior root winds around that internal jugular vein. And then, step 4, this is the magic moment where the U-shape is completed. Those two descending roots join together right in front of the common carotid artery. And hey, here's a fantastic geographical landmark for you. This junction happens precisely at the level of the cricoid cartilage. Perfect spot to anchor your mental map.
All right, part 4, wiring the strap muscles. We've got the structure down, but what's its actual job? Well, think of the Ansa cervicalis as the primary power cord for a very specific group of neck muscles called the infrahyoid muscles, better known as the strap muscles. As this U-shaped loop hangs out on the carotid sheath, it shoots off branches to power these targets. It wires up the sternohyoid, the sternothyroid, and both the superior and inferior bellies of the omohyoid muscle. These guys are absolutely crucial for depressing the hyoid bone and larynx when you're swallowing or speaking. Without this loop, those strap muscles just wouldn't get the electrical signal they need to fire.
Which leads us to part 5, the thyrohyoid exception.
You know, for every structural rule in anatomy, there is almost always a fascinating exception. And this one is a classic medical education trap. Look at this quote directly from Vishram Singh's text. It supplies all the infrahyoid muscles except thyrohyoid, which is supplied by nerve to thyrohyoid from hypoglossal nerve. Did you catch that? The Ansa cervicalis supplies all the infrahyoid muscles except the thyrohyoid. The thyrohyoid is technically an infrahyoid strap muscle, but it completely refuses to get its power from the main Ansa cervicalis loop. It gets its own dedicated supply instead.
So if it's not getting plugged into the Ansa cervicalis loop, where's the signal coming from? Well, the thyrohyoid is directly supplied by C1 fibers. But here's the wild part. These C1 fibers aren't traveling inside the loop, they're literally hitchhiking. They jump onto the hypoglossal nerve, ride it for a little bit, and then branch off as their own specific nerve to supply that single exception muscle. It's such a cool little anatomical detour, and honestly, examiners absolutely love to test you on it.
Let's wrap things up with a conclusion and knowledge check.
We've navigated some incredibly dense neuroanatomy today. We dropped our pin on the carotid sheath, built that U-shaped loop, and wired up the strap muscles. Now, to really lock this into your long-term memory, I want you to ask yourself right now, which infrahyoid muscle is not supplied by the Ansa cervicalis? Go ahead, visualize the loop, picture those hitchhiking C1 fibers, and lock in your answer. Awesome. Thank you so much for joining me for this focused explainer. Keep relying on those structured visuals, keep asking questions, and I'll catch you in the next one.